What we do as chronic care management nurses is we act as an extension of the provider to assist their patients with active management of their care. So that includes ensuring that the patients receive all recommended preventative services, providing oversight of the patient's medication management. A lot of times the doctors believe they're taking one thing and the patient is no longer, or vice versa. So we definitely, help with that and making sure that it's all correct and accurate. We improve communication among all of the treating providers for that patient. And we also simply can alert the provider, the physician, of any changes that we discover in between the patient's regularly scheduled appointments. Oftentimes, they only see the provider once a year, maybe twice, and a lot happens, a lot can change. So, because we are reaching out to them so frequently, we can alert the doctors of anything, any kind of change that they need to know. So, that's how we can provide the doctors with providing the patients better care. Wellbox is a patient-centered organization in regards that the patients, they can expect a care plan that's tailored to their specific needs, to their choices, to their values. So a patient-centered plan of care takes into account things like their cognitive abilities, environmental factors that may affect the patient's abilities to implement certain components of the care plan. In addition, we're able to provide quality one-to-one time with the patient. So the patients, they know that we care about them, that we care about what's happening in their lives. And I think that they really feel that after every call. I hope that they really feel that after every call. But I will forever remember one sweet little lady. Um, she she was an elderly lady. She had no immediate family around her. Her husband had passed away right around the time that she started the chronic care management program with Wellbox. So she was alone. She had her church, and that was about it. Um, but I knew that my calls to her, they were one of the very few calls that she would get every month. And it was certainly probably one of the very few calls that would be all about her. Um, so even though some months she really didn't have any changes, she didn't have any um, medical needs per se, she would get 15 to 20 minutes of undivided attention from me. And that, I feel like that just did so much for her. She would always comment about how she appreciated it, how it was nice to know that somebody out there knew that she was there, that we were, helping her stay on top of her health.
My name is Haley Hodge. I'm the clinical director here at Wellbox, and I'm here to answer a few of questions that we've been posed. What we are trying to accomplish is improved quality of life and improved disease management for our patients. So everything that we do kind of culminates to a healthier population, specifically a population with chronic disease and who need assistance with chronic disease management. Focusing patients in on what they need to be doing to manage their own health is key. We are focused on quality clinical outcomes, and that is truly a healthier patient population that is more engaged with their own disease management. And it's understanding that you have someone who's clinically trained to escalate issues, to talk with patients, to educate patients, to help with compliance. And then it is also kind of a feather in their cap when we complete successful things like gap identification. So with a patient, Medicare is recommending specific things like an annual wellness visit or a flu vaccination or a pneumonia vaccination or compliance with their medications. And the more that our nurses can check in, the more that they can educate on why it's important to do these things, help get appointments scheduled, get them back into the office, and get those screenings, those immunizations, vaccinations, the scans that they need to have, the more value-based care providers can see that benefit from Wellbox. So we can truly help kind of push the needle on quality measures and quality outcomes that many hospitals are being reimbursed for. Many providers are now being reimbursed for. Wellbox is valuable to patients because you have someone clinical checking in with you outside of your regular office visits. You have someone encouraging you, holding you accountable, there to answer questions for you. Someone reliable that you're checking in with every month. It's really driving patients into the appropriate level of care. So with healthcare costs, you have the really high, bad, expensive costs of hospitalizations and readmissions. But then you have the good healthcare costs of patients going to see providers, patients getting supplies and equipment that they need, patients going into outpatient rehab instead of inpatient rehab. So chronic care management can really drive the good healthcare costs while reducing the bad healthcare costs.
Wellbox is good for patients because we pick up on issues before they become problems, and we decrease the number of patients from being hospitalized. We also educate their patients on chronic diseases, and the more educated the patients are, the more they are engaged in their own health.
Hi, this is Dr. Peter Weigel. I'm an internist in Westfield, New Jersey, and I've been using Wellbox for approximately 5 years now. I think it's been very helpful for my practice in terms of keeping patients engaged with their own care. A lot of my patients are elderly and of Medicare age, and I find that the more touch points we have with them, that is, the more times somebody from the health field reaches out to them, the better their care has become. But when we have our chronic care coordinators calling them every month to check in on them, to make sure they're taking their medications appropriately, that they're exercising, and that they're following up with the appropriate specialists, this keeps them much more engaged in their care. I would definitely recommend Wellbox for the busy internist or family practitioner who wants to improve overall health and wellness of their patient population.
So for me, the reason I got into population health and care management to begin with was because I was an ICU nurse for many years, and we saw a very short snippet of what was going on with a patient. It made it really difficult to make an impact or see what was going on with them long term. And I had countless stories about how I would have a patient come in and, you know, they'd be very sick. And as we were able to get them well, we realized that had they had some coordination prior to coming to the hospital, like education on specific disease processes or medications or resources that they didn't have available to them, that they could have mitigated the risk of even entering the ICU. So it became an epiphany for me that, you know, if I could get out there and help them before they get here, that's going to be a bigger impact. So I got into care management, and from care management, I realized there was a lot that could be done on an organizational level. When Lightbeam got into the care management arena, it was because of those same reasons. It was because we have this powerful tool of analytics where we're able to really look at what's going on with the population, what's driving the cost, what the utilization looks like, but how do we impact that? And to impact that, we had to take it back to the patient level. And to take it back to the patient level, that means engaging them in some sort of care coordination, care management, chronic care management, all of those types of programs.
CCM has had a big impact on the healthcare system overall, and Wellbox is in great position to increase that impact over the next few years. Over the last 24 months, we've been able to complete over 250,000 interactions, and we base our success on the clinical and financial outcomes that we drive for our patients and our providers. With that equals some very big wins for the healthcare system as a whole. For example, by providing high quality care, we've been able to save 5.6% of the total cost of care. And within our own populations, we've increased preventative care 2-3x while reducing the overall hospitalizations by up to 75%. The value for the healthcare system as a whole will only increase, and as more providers adopt CCM and more patients participate, and Wellbox looks forward to being part of that success and growth over the next few years.